What if I told you that your body might be trying to send you a secret message about your liver right now? It's speaking a hidden language, using clues in your skin, your nails, and even the air you breathe. Seriously, just think about it for a second. We all do it, right? We dismiss the little things. A strange mark here, a weird feeling there. But as a doctor, I see these exact signals in the hospital every single day. And you know what? A lot of the time, they are the very first clue that something serious is happening under the surface. So that's what we're going to do today. We're going to decode these hidden messages together. Your nails, your skin, your breath, they are talking. Now, this isn't about freaking you out, not at all. It's about learning their language so you can actually listen to what your body is trying to tell you. And we're going to start with something you can check literally right now. No appointment needed. Just look down at your hands. You'd be amazed what they can reveal. Okay, first up, your fingernails. Take a look. Do they seem really pale, almost a milky white color? And is that little half-moon shape at the bottom kind of gone? That's a classic sign called Terry's nails. It's a huge hint that your body might be low on a protein called albumin. And guess which organ is the main factory for making that protein? Yep, the liver. So this is a direct signal that the factory might be having some trouble. All right, you ready for a quick at-home test? You can do this with me right now. We're going to see if you have something called the diamond gap. Okay, take your 2 index fingers and press the nails against each other, back to back. Now look right at that little space between your knuckles. You see that little diamond-shaped window of light shining through? If you see it, awesome. That's totally normal. But if that gap is completely gone, if your fingertips look kind of swollen or rounded, that's a sign we call clubbing. It happens because extra tissue builds up under the nail bed. Now, for some people, it's just genetic. But if this is a new change for you, it's a major red flag for doctors to check out the liver, but also the heart and lungs. Okay, one more test for the hands. This one's super easy too. It's called the tabletop test. All you need is, well, a tabletop or any flat surface. Go ahead and place your hand, palm down, on the table. Now try to get your entire hand, palm, and all your fingers to lie perfectly flat. Can you do it? Or are 1 or 2 of your fingers, usually the ring or pinky finger, kind of stuck in a bent position, pulled inwards? If you can't flatten that hand, it might be something called Dupuytren's contracture. Basically, the tissue in your palm thickens and starts pulling your fingers in. It's got this wild nickname Viking disease because of its Northern European roots, but it also has a really strong connection to liver disease, probably because of how a struggling liver messes with your body's metabolism. Okay, so we've covered the hands. Now let's move on to the skin. And while the clues on your hands can be subtle, the signs your skin gives you, well, they can be a lot more dramatic. Just look at this number, 15 liters. That is almost 4 gallons. Now, I want you to imagine all of that fluid not sitting in these jugs, but trapped inside a person's belly. It's a shocking amount, and it is a hallmark sign of advanced liver disease. This condition is called ascites. It happens when a damaged, scarred liver basically creates a traffic jam for your blood. The best way to think about it is like a garden hose. The main vein going to your liver is the hose. If you pinch it, what happens? The pressure builds up and water starts leaking out, right? It's the exact same thing here. The pressure builds and fluid leaks out of the blood vessels and fills up the abdomen. And this quote from a doctor really just brings it home. He's talking about a procedure to drain all that fluid out. You can just imagine the immense relief that patient must have felt. I mean, carrying all that extra weight, it would be so hard to even breathe. But your skin has other ways of talking too. Of course, there's the classic one, jaundice. That's when your skin and eyes turn yellow because the liver can't get rid of a substance called bilirubin. You might also notice these tiny, red spiderweb-looking blood vessels. Those are called spider nevi, and they pop up because a sick liver can't process hormones like estrogen correctly. And finally, if you find yourself bruising super easily, like just from a tiny bump, it could be because your liver's protein factory isn't making enough of the stuff your blood needs to clot properly. Okay, now for the part that I think is just wild. It's the direct, powerful connection between your liver and your brain. The idea that a problem down in your abdomen can literally change your state of consciousness, it's mind-blowing. One of the clearest signs of this is a special kind of tremor called asterexis. If you ask someone to hold their arms out straight, their hands will involuntarily flap down and up. It's not a normal shake. It's happening because toxins, especially ammonia, that a healthy liver would filter out, are building up in the blood. those toxins travel to the brain and start messing with the signals. It's like the brain's wiring is getting short-circuited. And it can get way more serious than just a tremor. Get this. Here's a true story. A doctor walks into the ER and there's a patient who is found totally unresponsive. The whole medical team is buzzing around trying to figure out what on earth is going on. It's a complete mystery. So they check all the usual stuff. His vital signs? Stable. Blood sugar? Normal. They even try what's called a painful stimulus to try and get a response, and nothing. The guy is completely out of it. All the common culprits are being ruled out one by one. But then, the doctor notices one small, very strange clue. He leaned in close to the patient, and he smelled it. A really distinct, musty, kind of sweet smell on the patient's breath. It was a smell he'd been trained to recognize, and in that one instant, the entire case cracked wide open. That smell actually has a medical name, HYPERTHYROIDIS. It's Latin, and it literally means foul odor of the liver. It's the smell of all those toxins, that ammonia, building up in the blood to the point that you are literally breathing them out. This patient's brain was being poisoned because his liver had failed. And the most amazing part, the treatment was a simple laxative. It cleared out the gut bacteria that were making the ammonia, and the patient woke right up. Just incredible. So look, the whole point of all this isn't to make you paranoid. It's to empower you. Knowing the signs is the first step, but knowing how to protect your liver in the first place, that's the real game changer. So let's talk about prevention. And here's the really good news. So much of liver disease is preventable. The top 3 causes are, number 1, drinking too much alcohol, so moderation is absolutely key. Number 2 is something called metabolic syndrome, which is tied to obesity and diabetes, so maintaining a healthy weight is a huge deal. And number 3 is a viral hepatitis. We have a vaccine for hepatitis B, and now we actually have a cure for hepatitis C, which is just a monumental leap in medicine. You know, your body really does tell a story. Every single day, it's sending out hundreds of these little signals. The most powerful thing you can do for your own health is to start learning its language and just pay attention. So I'll leave you with this question. Are you listening?